Hey everyone, it's Christian. My apologies, I totally spaced, forgot to do the lung and thorax video for last week. Got super busy. I just, for whatever reason, just lost it. But we're all good. We're luckily going to be able to do it today. So let's get started here. Again, we'll be using Bagsley here as our demo video. As our demo patient, I should say. Like always, we would introduce ourselves, state who we are, what we're here to do. Hi, my name is Christian. I'm a student nurse. Check two identifiers, so name, date of birth, hand hygiene, all that good stuff. And then we sort of give some privacy and proceed. So let's get into it, okay? Hi, Mr. Bagsley. My name is Christian. I'm going to be your student nurse. Could you please tell me your name and date of birth? Excellent, thank you so much. So today, Mr. Bagsley, what we're going to be doing basically is we're going to be looking at your thorax and lungs, okay? So what I'm first going to be doing is I'm going to be looking to inspect. He's got normal breathing, normal respiration. He appears to be normal. Breathing seems to be fine. Everything appropriate to normal breathing records. Okay. There's no pallor, cyanosis, or jaundice. His skin is even. He doesn't seem hunched over. Use of any sort of supportive muscles or accessory muscles, and then no evidence of ICS bulging or any sort of retractions, okay? Shape and configuration of his chest wall, if you look here, it looks fairly even, no deformities, no lesion scars, or any color differentiations, okay? And then if we look here, so his AP to transverse, so if you do him sideways, so then he has sideways here. So AP, which is this way, anterior to posterior, to his transverse, is within the normal range of 1 to 2. So that's great. There's no evidence of barrel chestedness. Get it, barrel? There, barrel. All right, so let's get started. So what I'm going to do, Mr. Bagsley, first is I'm going to turn you over to our posterior side, and I'm going to check for lung expansion. So what I'm going to do here is I'm going to go at the costal angle in the back, and then I'm going to hold here, and I'm going to ask him to breathe. And then as he breathes, what I'm going to be looking for is bilateral chest expansion, so my thumb should go outwards, showing that he is bilaterally able to expand his lungs with no difficulties. Okay. Then next, what I'm going to do on the posterior side, now that I have him, is I'm going to percuss over the posterior fields. So I'm going to go down and across motions. So down and across the apices, and then ladder formation across the back of the chest, and then also check for any CVA tenderness. Okay. So what I would do is I would go here. Okay, and then to check for CVA tenderness, what I would do is I would then get him on his back, and I would then percuss with the palm of my hand, put it here, and then I would just go. And then no evidence of CVA tenderness, which is good, that's a normal finding. All right, so then what I would do, and since I still have him on the posterior side, I'm going to auscultate his lung fields, okay? So again, kind of the same way I went about it with the percussing, I'm going to go top to bottom and then ladder motion. One thing I also forgot to mention is as I'm doing this, I would instruct the patient to breathe normally every time they feel my diaphragm or my stethoscope touch the back. Okay, that takes care of the posterior side. Again, we did the apices across, then we did ladder down the lung fields. Also, I don't know if you were able to see, but you have to get on the right side, the right middle lung, or right middle lung lobe, I should say, as the right lung has 3 lobes, comparatively to the left lung only having 2. Okay, so Mr. Bagsley, what I'm going to do now is I would turn you over, and then we are going to auscultate your anterior side. So same thing, we go with the epices, and then we go down the lung fields, and then this is where we would also listen for any adventitious sounds. Normally in the fields, before I do that, you would want to see bronchial sounds right here by the bronchi, or trachea, I should say. Then you want to see bronchial vesicular sounds right here in sort of the sternum area. And then on the outer fields of the lungs, you would want to hear just vesicular sounds. Okay, so let's get started. Okay, thank you, Mr. Bagley. That pretty much concludes our inspection of your lung and thorax. I appreciate the time, sir. I'm going to leave your card light here. Is there anything else I can get for you at this time? Okay, great. Please let me know if you need anything, and feel free to use your call light to call me back for any thing I can help out with. Thank you. So at this time, I would basically just state the findings here. So respiratory rate, even and smooth. No use of accessory muscles or intercostal space abnormalities or ICS abnormalities. AP to transverse ratio was definitely proportionate towards positive findings. So 1 to 2, no evidence of barrel chest. Symmetric chest expansion on the posterior side. Resonance heard throughout. Posterior and anterior lung fields, percussion appropriate for their designated regions. Also, bronchial vesicular and vesicular sounds clear and within their appropriate places. Lung field sounded clear bilaterally, and then no adventitious sounds were present at this time. Awesome, thanks guys, I appreciate it.